Good morning, Dr. Ankit.
Good morning, sir.
I'm fine. How are you?
I'm fine, sir.
It's so nice. Dr. Ankit.
Sir.
So I hope that you have a talk with Professor Pant today.
Yes, sir. Yes, sir.
So you please ask accordingly when he has to join. Okay.
Yes, sir.
Dhanasri, shortly we are going to start. Dhanasri, are you ready?
Yes, sir. Yes, sir. I'm ready.
Fine. Only one. Now it is time is there. So it is the right time that we should start the program. It is 11 o'clock. Now, good morning to dear our distinguished panelists, Dr. Ankit, Dr. Raju, and also as well as our this moderator, that Dhanasri Sharmaji, and our honorable as well as distinguished participants who are with us. Now we should go ahead for this today's program. You know that today is the final day of this 3 days training program. That is the training on disaster risk assessment and management, and it is going on in collaboration with the Central University of Himachal Pradesh. In this regard, again, I welcome you all. Now I hand over to Dhanasri ji. Dhanasri, please continue.
Yes, sir. Sure. Namaskaram, everyone, and a very warm welcome to you all. Today, again, we are very happy to have you all with us. As we know that this is the day 3, that is the last day for this particular 3 days online training program on disaster risk assessment and management, organized by National Institute of Disaster Management in collaboration with Central University of Himachal Pradesh. We once again want to extend a very warm welcome to all the panelists and NIDM officials, our experts, participants, and especially to AL Hardar sir, who is extremely genuinely welcoming and a wonderful host. So with this, before dwelling into today's technical session, I would like to request Dr. AL Hardar sir from NIDM to kindly give a brief recapitulation about yesterday's event. So over to you, sir.
Okay, fine, Dhanashriji. Now, I should appraise very in a gist way about the yesterday's program. Yesterday, that was the 30th August. That was the second day of the training program. That is the disaster risk assessment and management. And in that day, or that was on the second day, yesterday, that there were 3 lectures was there. First lecture was taken by Professor R. Shivakumar from the Department of Civil Engineering, SRMIST, Chennai. So he talked or he delivered the lecture on the topics geoinformatics applications for seismic study and case studies. On that topic, Professor Shivakumar talked about the apart from the different geomorphic indices and geoinformatics applications, he said that different methodology about generation of digital elevation model. He also discussed the advantage of GIS customization, a beautifully customization he made on the seismic study, how to different aspects, especially that will help for the planning of the seismic predicator or the seismic administrator who can work in that seismic prone region. That customization can give a lot of relief. And he also, that is Professor Shivakumar, also discussed about the morphotectonic and drainage anomalies identification, as well as share different interesting field observation in Gangtok and Mangaon places. So that was by Professor Shivakumar. Next lecture was given by Wing Commander K. Venugopal. He is presently head of Global Head ISAC Arrow, and he delivered lecture on reduction in cyber disaster risk. On this, his topic, he described in detail from the basics of cyber disasters, cyber security and its component. What are the do's and don't do's in addition to the disaster recovery plan? He also gave an overview of cyber disaster management. Apart from all these, he gave glimpses of developing a cyber preparedness plan and talked about cyber terrorism as well. He also highlighted the needs of cybersecurity awareness and also gave information about some of the courses offered for skill development in this venture. So after that, the third lecture and final lecture for yesterday was given by Ms. Vinita Kumari. She is from NIDM, young professional. She talked on forest fire in India, trends in incidents and causes. She comprehensively explained right from the officials of MOEF, Ministry of Environment and Forest, and different reports about the various types of forest cover, factors that is influencing on forest fire. She also discussed about the fire prevention and mitigation measures on that topic. She said that highest forest areas are in MP, that is Madhya Pradesh, Arunachal Pradesh, and Chhattisgarh state. She explained about types of forest fires that is taking place in different regions. So that was very good number of participants were present. 216 and odd participants were there. They have attended through the online. Now, after this, today we'll be taking sessions for that. Dhanashriji will be telling about that. Dhanashree, please, over to you. Dhanaswari, your voice is not coming.
Am I audible now? Sir,
Now,
am I
yes.
audible?
Yes, now it
Okay.
is coming.
Okay, thank you so much, sir, for a brief recap. So moving towards our technical session. Today we are having two lectures, and the first lecture would be given by Dr. Raju Thapa, sir. He would be delivering his lecture on the topic Public Health Emergency Management. So a brief introduction about him. Dr. Raju Thapa is actually working. Dr. Raju Thapa is actually working for emergency management team for Center for Disease Control Prevention at CDC New Delhi. Prior to this, he was working as junior consultant at Early Warning and Communication Center, Geometeorological Risk Management Division, NIDM. In addition to all these, Dr. Thapa has been associated with two different major projects sponsored by DST SERB as well as from Nuclear Sciences BRNS. As of now, he has published more than 50 publications in top reputed journals and has coordinated more than 100 webinars, online training programs, and in-person training programs as well. Dr. Thapa has also contributed in developing training modules on communication for disaster management at NIDM. So with this much of introduction, I extend you a very warm welcome, sir, and I would request you to kindly proceed towards delivering your lecture. So over to you, sir, now.
Thank you very much, ma'am. I hope I'm audible, loud and clear.
Yes, sir,
Ma'am?
you are audible.
All right,
Yes,
thank
sir,
you.
you are audible.
Thank you. First of all, I would like to, wish all our participants, our panelists, a very happy Ganesh Chaturthi. As this day is celebrated for the new beginning and the remover of the obstacles, as well as the God of wisdom and intelligence. So let us all hope that this training program, we get the blessing of Ganesh Chaturthi, and also we learn and we move towards in our goal of making our country a disaster resilient country, and disaster, and move every step towards enhancing our disaster risk reductions and resilience. So in this regard, just let me share my presentation. I have prepared a sort of presentation. So is my presentation visible?
Yes, yes, Dr. Raju, it is coming.
Sir, is it full screen, or you are seeing two multiple screens?
Full screen.
Okay, thank you, thank you, thank you. So, like I was saying, so I have seen the schedule. It has been very well planned. So there were various topics that has been touched upon, and one of the topic that I was given the responsibility was to talk about the public health emergency and disaster management. We have seen that during the COVID-19 pandemic, it has taught us many lessons. Perhaps one of the most prevalent, weaknesses was the constant challenges of the coordinations that we have faced during this COVID-19. This has become more evidence in many countries that highly intelligent leaders and workers with exemplary skills, they have somehow managed, but still it was seen that there was lack of coordinations between various stakeholders, and that was and the linkages was keep breaking up. And because the COVID-19 was a very big learning lesson for all of us. And it has also shown us, it has highlighted many key areas where we lack, where we need to focus. That has been one of the key, key advantage of that, I would say. And both progress and efficiency, it suffered as a consequences of that. And in contrast, countries having very robust coordination system and using those who are implementing incident management systems, like in our country we have incident response system, they have resulted in better management of the pandemic as compared to the other countries who didn't have implementation of that. So the shifting contours, I'm very interested to listen to our Ankit sir, who will be just speaking after my presentation, where sir will be giving us the ideas of, the upcoming trend change, trend reversals due to, the rainfall, and that is in the very similar line. What everybody will agree with me that disasters are reported to be increasing in countries in not in India, throughout, there's an increase in number of disasters, both in frequency and also the intensity of the disasters are also increasing. Whether be it the biological disasters, we have seen the COVID-19 earlier, like Zika, the Ebola, the influenza. There are so many others, dengue, all that, the outbreaks. You talk about the chemical disasters, the Bhopal tragedy, the Baghjan tragedy last year, the Vizag gas leak. You are seeing that the chemical disasters are also increasing. Apart from that, the natural disasters also, the cyclone, the flood, the earthquake, tsunami, cloudburst, uh, all are in a rise, in the numbers. When you see, just let us take an example of the cyclone in 2021. You will be how many cyclone hit our country. We had the cyclone Tautke, we had the cyclone Yash, we had the cyclone Gulab, we had cyclone Sahin, we had the cyclone, what was it, the Jawad. The five cyclones one, and apart from that, we also had six depressions in Bay of Bengal, and three depression in Arabian Sea. Right. So what does that mean? That means that you see the intensity, the number of cyclone, the cases, or the cyclone frequency has increased a lot. That give us an idea that the disasters are increasing, and it also indicates us that we need to be extra prepared. We need to be extra cautious about the disasters, because now disasters don't come alone. They bring their sisters, brothers, everybody. Like during COVID-19, what we have seen during COVID-19, we are facing several other disasters also. We were facing flood, we were facing cyclone, earthquake. Everything was there during COVID-19. So there are multiple hazards occurring all at once, which that this is the way that we have to look forward, and we have to move ahead. So why we are talking about this capacity building for public health emergency and disaster management? We have faced several waves of COVID-19 pandemic, as you have seen, that has led to a sudden increase in resource request also. Apart from that, the deliveries and deployment. Deliveries in the sense, now whenever there is a disasters, the expectations and hope of the citizen, it increases. It increases on the government, or the organizations that they are looking on. But what we have to understand is that this has posed an challenges to maintain the oversight and keeping the track of public health actions within an overstretched and limited workforce context. That means we have limited workforce. You can very easily relate it with the the workforce, the medical workforce that we had during COVID-19. The stretch that they were doing, our medical team, our hospital team, they were there 24/7, right? So that is the thing that I want to highlight, that our workforce, we have to make it so capable that we are already ready to face another COVID like scenario. That we have what we have understand, that why we need capacity building. Apart from that, the government of India is also taking all necessary steps to develop the capacity to face any surge in cases of COVID, and also similar like pandemic that can occur in future. And this capacity building is in emergency response requires a very structural platform to sustain and maintain the additional capacities that may be required during health emergencies for an efficient response. Until and unless you have an structure that is there, that in place, we have the role and responsibilities assigned to each individuals. We won't have a system that is that is proactive rather than reactive. To be a proactive system, we need to have a very structural, well planned, well thought of system that is put in place before the disasters. So this is where we are looking ahead, and this is where we think we need the capacity building for, especially for public health emergency and disaster management. So in this short topic that we are going to do, I will just touch upon few of the things, like what is this whole public health emergency management thing, and what are the key components, and why do we and we also try to understand the applications and basics of public health operation PHEOCs. We go, so somewhere you might have heard of EOCs, also emergency operations centers. We call it war room. There are several names. The nomenclature may be different, but the functions is the same. And we will also try to understand what is the IMS, incident management system. In India, we have incident response system, because for the functioning of any PHEOCs or EOCs, we must have an a dedicated and functional IMS, so that the EOCs functions automatically and autonomously. So that way, what is IMS? We'll just go through the terminologies very. We'll just go over the top, just touching upon few terms. And we will also know the initiatives taken by government, like what are the few initiatives to strengthen the health sectors also, and particularly EOCs and IMS. And available, if since we are here, we have a large faculties also who are joining. So if anybody is interested about building their capacities or finding out resources, so we will just discuss 1-2 websites or sources where they can enhance their capacity in public health emergencies. So, the government of India, they realized the need for a sustainable, resilient public health infrastructure and program. And the PM ABHIM, Ayushman Bharat Health Infrastructure Mission. This PM ABHIM, it focuses on strengthening the national public health institutions, expanding the integrated health information portal or IHIP, and also it focuses on operationalizing the several public health units and the establishment of public health emergency operation centers. So a dedicated fund has been allocated here, where they are planning to set up various, several health units. NCDC is the National Center for Disease Control. This is, you can say, this is the nodal agency who's looking after the public health aspect in India, and so this is one of the initiative that has been going on under Government of India. So this public health emergency management, whenever we are talking about that, is a field of practice that provides a single integrated approach that countries can use to prepare for and rapidly respond to public health emergencies and mitigate the threat that is there. So whenever we are talking about public health emergency, the name itself suggests, whenever we are talking about that, the three components that needs to be looked upon are the infrastructure, the staffing, and the system. We sometimes also refer as the 3S, that is the system, the staff, and this is, we call it sometimes stuff. So here, the three component, each of them has to be given equally importance, until unless we excel in and we develop in all the three component of public health emergency this public health emergency management, we cannot have an effective system to respond. So that's why infrastructure, to respond to any situations, any disaster situations, the first thing we need is the equipment, right? Without the equipment, how you can go to a war? So we need the EOC facility, we need the powers, we need the communication infrastructures, we need the data processing and visualization. Similarly, to use that sophisticated or system equipments, we need a trained manpower. We need the trained staff also. So we need trained staffs who knows the basics of IMS, who know the incident management, because during any disaster situation, the time is very limited, and until unless we are prepared from before, we cannot execute, or we cannot make use of the time that we have. So that's why, to fully utilize the golden hour that we have after any disaster, where we can save the maximum life, we need to be well prepared. Our staff need to be well prepared. They need to have that minimum capacity, that to use that infrastructure that is in place. And those staff, they need to function under a system that is already there. So this system, it talks about the plans that are there, the accountability, the operation support. As soon as there is an indications of an incident, the systems get activated, and all of this, the staff, they get also activated. So this is what the general concept of FAM. And in any FAM program, when we see this FAM capacity building, this is organized for three different levels. The one is the strategic level. This is responsible for strategic coordination and policy making, like the think tanks, the think steering committees, and the policies, or the resource group. This this FAM program organization, they target for those levels. And the operational level also, when is the one who are there on the field. They are responsible for the effective coordinations of response elements, and also the maintenance of sustainable awareness for the strategic level leaders also. And the last one is the tactical level, because response for the day-to-day actions that will achieve through strategic objectives. So that needs to be done at the tactical level also. And the four component of any FAM program, so resilience and recovery. The first is the what we need to understand is that in any public health emergency management is the risk analysis. Until unless you know your risk, you cannot take appropriate action to reduce those risks. So this risk analysis is used to the protect the public health, the environment, by organizing and communicating knowledge about the health risk within a framework that is used for decision makings. And the risk analysis is used to inform also the regulatory policies and addresses the concern associated with the health hazards in the environment. There are several steps that are associated in this risk analysis. That is a topic for discussion for some other, but just to give you like the identifying the information that you practice, identifying the risk that is existing there, the vulnerability that are there, what are the threats and the exposure that are there, what are the policies and procedures that are there that you can implement, you can use, and also determining the level of risk and potential impact of the threat. All this can be done in risk analysis. Based on this risk analysis, that can be used by the policymaker, the decision makers. Based on those analysis, they can take appropriate actions and appropriate decisions. The second component is the preparedness. Preparedness involves several points. It includes right from the plan or what you have already there to take the actions, or preparedness made to save lives, to help resources and rescue operations. What you have, what is your standard operating plans that is already there, evacuation plans, what is the stocking food and water. Examples are, they are all examples of preparedness. Monitoring, what is going on, the monitoring of that situations, that is all preparedness activities takes place before an emergency occurs. Then come the actual response. In response, when we talk about response, there are several things that we need to consider. First thing is that we at our present knowledge of science and technology, one thing is very clear, that we cannot stop disaster from occurrence. Though we can minimize its effects, natural disasters, there are some disasters we cannot prevent from its occurrence. So we have to learn to live with the disasters, but we can somehow minimize the effect of that. For that, there are several points that needs to be taken care of for response, because it is immediately after disaster that it is very crucial time to save the life. So we need to have from earlier very coordinated, cooperated, mock drills also involving the community also, so that during the actual scenario, everybody knows what is their role, what is their responsibility, and what they have to do. Because during response time, we have to be a part of the response team, not a part of the the problem where responder has to focus on to save your life. And during response, the basic things that needs to be taught are like, the primary focus should be the safety of oneself, rather than going for other things. So your safety first, then you save your friend and families, then your surrounding. This simple things, if this is known to the people, known to the community, that will play a very important role. That's why regular capacity building, not only at the higher level, but at the grass level, at the community level, that is also very important, because community are the first responders. Until and unless they are aware, they are well aware what to do, how to act, then only we will have a very strong system, a very strengthened system, where the community are aware and community are self-competent. So we need to conduct more of mock drills, more of capacity building for that. And the last component is the recovery part. The recovery, it begins immediately after the threat of human life has subsidized, and the goal of this recovery phase is to bring the affected area back to some degree of normalcy. And like in Sendai framework, the priority for there are 4 priorities. In one priorities, it says that we need to focus on recovery and building back better. Whenever we are building back, we need to build back better. So this is our objective, and currently we are recovering back from COVID-19, and also similarly uh, for other disasters also there is a recovery phase. But in FAM, why I need to talk about that is that we need to have a plan from before how we are going to or execute this part, how we are going to execute our recovery phase. So that needs to be there, that needs to be planned, that needs to be thought beforehand. Then you can have an executions. One more thing, just I want to highlight and just talk about the PHEOCs, the Public Health Emergency Operations. It is very similar to what we do in our disasters EOCs. So the rest, they are, the purpose of this is to they are responsible for the strategic and operation overview of the incident. Uh, Sometimes when they are deputed in the field, they directly they control the field assets. They have their incident manager. I will just give you a slide later on how it is managed. um, they are responsible for everything in the field, right from the information collections, making decisions, maintaining continuity, disseminating that to the further policy makers or the other agencies and individuals and the communities. All are done by them, and most of the EOCs, there is one individual in charge, incident manager. I will just give you that. And we need to plan for future response actions or recovery and return to normal state. That COVID-19 has definitely taught us this, that we need to be alert all the time, and we need to have some SOPs ready, some contingency plan ready, our DM plan ready, so that during actual disaster everybody knows what is their role, what is their responsibilities. And this PHEOC, just give you an example of PHEOCs, and there are different types of PHEOCs, dedicated and multi-purpose PHEOCs. One PHEOCs where, a dedicated PHEOCs facility are generally found at the national level. They may also be regional, also districts, country. And the PHEOC, they can also often do on a multi-purpose also. If space is used for activities which are not related to emergency preparedness and response, they can also training. And in NIDM, we also have one year training. We are planning to develop one training EOCs. So if you talk about the essential component of EOCs, you will see that the left side of the slide shows 4 key components of PHEOC. So that is plan and procedures, the data and informations, and the physical facilities or locations equipped with technology, and the skilled trained professionals that are required for establishing an operation and operational functional PHEOC. And in the right side, there are 3 handbooks shown that are published by WHO for developing a PHEOCs. The handbook consists of 3 separate documents. Part A, it talks about what are the policies, plans, and procedures that you need to focus on. It has been talked about in Part A. In Part B, it covers the physical structure, information, and technology systems that needs to be there in any EOCs. And the Part C, it covers the training and exercises, because untrained or untrained human resource is of no use. Even if you have the dedicated EOCs, you have the highest sophisticated technology, but if your manpower is not well trained to use those systems, then that is of no use. So that's why the special focus has also been given on the training and exercises. And this PHUC, it brings together with different skill sets and experience to a physical location, making it easier to work and plan together, to support the public health response need. And now you cannot see public health disasters in silos. You have to see them together. So to support the public health and disaster management response, it provides the capacity to receive, analyze, display, and monitor the incident informations, and also to organize, to deploy. Like I said, all things are done by there, and the track resources, and also to communicate, to collaborate, and coordinate from a centralized locations. There can be various types of PHOCs, like the type A, where it is at some like district level, suppose the type B, where it can be at state or national level or at the international level. So all that, there are different types of PHOCs. Examples, like some of the examples that you can see here. Example of PHOCs. So and you need to understand that each emergency management is very unique, and however there are varieties of factors which are important to consider for all activities. This is each emergency management is affected by the magnitude, location, and impact of the disaster, impact of the event. Apart from that, any emergency management is also affected by the what are the availability of human and material resources to address those events, what are the legal and policy environment and mandates that are there. That also affects the emergency management actions. And also what are the strength and weaknesses, strength and limitations of emergency response and management agency who is carrying out, the team that is carrying out. That is also very important. And also the degree of resilience in the individuals, in the social systems, in the community, in the health system agency. All that also is very important when you talk about factor affecting emergency management. This PHOC, they have a sets of the core teams who right from PHOC managers, operations plan, logistics, finance, and administrations. So we won't go in that much in detail, but just giving you an idea how an incident management system. So generally, IMS is the backbone of any EOCs. This IMS is a structure how the EOC works. So IMS is an emergency management structures and set of a protocol for that provide a standard approach to guide the agencies or the public sector, no NGOs, anyone who is implementing that, to how to carry out and coordinated manner response, primarily to respond to and mitigate the effect of the type of emergencies that they are dealing with. And we have to understand, like we have seen in earlier slide, the different types of EOCs. This can be applied to all level of emergency management responsibility within a particular system, whether it is the national level, state level, district level. It can be implemented at any level. It is very flexible system, and this organization system, it has the incident management system. It has the you can see the incident management functions is lead by an incident manager, and who manages the executive, strategic, operational, and also the command and coordination activity. It is under his supervision what is going on. The apart from that, we have the planning sections, we have the logistics sections, the finance and administration sections. These are all there. So why do we need this IMS? This IMS, it provide a, you can say the common terminology and structures for all partners, which promote clear communications and comprehensive all hazard preparedness. Suppose during take the example during the Nepal earthquake 2005, Gorkha earthquake. During that time, our team from India also reached there, and they provided the support there. If the terminology that they are used, that is not common, it will create a confusions, and it will also hinder the response activity. If you have a common terminology, common actions, then that, and not only in national response, international response also, if you have a common terminology for everything, the person who is responding is the incident commander, such thing, then it will be a very smooth functioning for the whole system. That's why we need to focus on the common terminology also. And is also encourage a multi-directional flow of information, not only from the information flow should not be always from top down approach or bottom top approach. It should be multi-directional, not only the vertical line, but also the horizontal information sharing should also be focused. IMS is a standardized approach that is scalable, like I said, flexible as per the emergency at hand, and additionally, in it enhance the cooperations and the interoperability among the responders. Also, there are several other benefits also that we can include, like efficient response coordinations at the level of governance, also implementation agency also. So, and one more important thing is that it also reflects the best practices and lesson learned. That it also implement taking in consideration of that, it takes the further action. So which is a very good point of carrying out any activities. be it any situations, whether it is the biological disasters, disaster outbreak, epidemic, pandemic, like you have seen this COVID-19, our MHA, how it got activated, how using the DM Act provisions it has implemented that. So whether it is the biological disaster, whether it is the natural disasters, chemicals, planned event like the suppose the gathering, the Kumbh Mela, or other religious events also, the where there is huge gathering of people, all that can be done in those situations. IMS can be implemented. This is part of the IMS. So the capacity building for public health emergency and disaster management is like, we have to focus on levels of capacity development, and not only at the individual level, at the organization level, network level, enabling environment, all that needs to be focused. And this public health emergency guiding concept, and IMS, like we have already talked about IMS, and this you can there are various modes that you can be used to learn all this concept, whether it's the collaboration, discussions, feedbacks, guide, all these methods can be implemented. And some sources which can be used, where you can update yourself with this information, is the WHO. Open WHO is in site. If you can go there, openwho.org. There are a number of programs, self-certification course that you can go and have a information about what is going on about the IMS, about the IRS, disaster management. So there are several courses. I will urge participant also to go and have a look. Some of the information are very, very useful, which has been developed by the global experts, with a number of discussions, with a number of case studies. So that will be very, very helpful. Apart from that, there is like I said, certificates. You also get certified for that course. That is very important. But to get this certificate, you have to go through exams, and at least you have to earn the 80% maximum marks to get that certificate. So that is also nice. And even our CDC also, they also have that training available for various public health emergency and disaster management. So you can go in and you can log in, create your account, and you can also access that. Apart from that, the FEMA also, they have their own courses that are going on. This is the Federal Emergency Management Agency, and there is a number of courses that are there, detailed courses. You can also access that. Uh, and UNESCO, even our UNESCO also have a number of courses, and needless to say, NIDM also conduct several courses on that. Just for your information, from 30 March, we have been conducting webinar series. Today is the 23rd of that webinar series, where we have been talking a lot about developing the workforce, developing where we have been focusing on all the 3S that we talked about: infrastructure, systems, staffing, that might be needed to enhance our capacities to face the COVID-19 and similar situations, and other disaster also in future. So we have been working on continuously, and today is the 23rd webinar of that. So I will also urge you to, if you have time, you can join that webinar also. Apart from that, NIDM also conducts several other programs, which you can go to NIDM training portal and you can check, have a look. If there are some topics that is of your interest, you can definitely take part on that. So I hope I am well within time. So, talking about the key takeaways that we can, learn from a slide, is that the importance of an incident management system or similar response. In India, we have incident response system. Somewhere it is known as incident command system. The name may be different, but the structure, the functions is quite similar. So the importance of this incident response system, or IMS, or any other similar structure, for internal organization use and coordination with also with the external partners, it cannot be overemphasized, and it is a very, very important, and we need to focus on that. And the flexibility and adaptation of the response structure and operationals, they are very critical for continuous improvement of our response system. And the advanced preparations, including the training the new personnels and conducting exercises, it ensures much more effective and efficient response when an emergency occurs. So this advanced training and capacity buildings needs to be one of our key priorities. And needless to say, apart from that, however, even in just-in-time establishment, which is immediately established IMS structure or an EOCs that we have seen during the COVID-19, several EOCs were established. They can also be beneficial during emergencies like COVID-19 if the staff have the desirable capacities, or the needed capacity or the knowledge to handle those situations. And this capacity building and the capacity enhancement during peacetime, like now, that is very, very important for the response during the wartime. So that's why we need to focus, we need to prepare more during peacetime. And lastly, I will say that the whole what our India's efforts to manage the pandemic can be best defined by an people-centric, whole of government and whole of society approach, built on the past experience also of managing public health emergencies as well as the contemporary scientific knowledge. So we must we must understand that we are going from this paradigm shift from and event based to rather risk based, where we are talking about not only one particular hazards, like you can see the single hazard to all hazard approach, but also from reactive to proactive, rather than reactive, going for response and relief. Now we are talking about emergency management, right from preparedness, to building our capacity. All that are also in center of our focus. Single agency to whole of society approach, like I said, and also rather than planning for community, now we are talking about planning with community. Until and unless we give the community, the stakeholder, we make them as a partner rather than as a recipient, until and unless we treat the community as a partner of that event, until and unless they take that ownership, they take that leadership, the community take that leadership, our whole efforts won't take that much, won't execute that much. So giving them the power, making the community that they are a partners, that is where the success lies. And planning any activity, in formulating any plans, policies, we need to engage the community right from the very beginning, so that they have that authority, they take that leadership. So with this, thank you very much. I end my presentation here, and I will be up for any questions if there are any questions. Sir, back to you, ma'am.
Yes, Dr. Raju. It is nice that you have proved that is public health emergency management, how much desire, and it is the pro for the public. And beautifully you have explained one by one, starting from say COVID period, and COVID has made us stimulating for what are the need for the capacity building and other things. Each and every aspect we should be prepared for that, to cater that disaster, and public should be given the enough capacity building so that they can also,
Yes.
to some extent, they can also take up their own things, and they can manage own as well as others also. You have highlighted very beautifully PHEOC, and that
Yes.
is the multi-purpose sector and essential components you have elaborated very beautifully. And I hope that our participants, they have realized this very nice session is there, that World Health Organization, CDC role, FEMA, NIDM, and lastly, you have told that paradigm shift, and one by one, it has to jump, it has to change all the things very proactively for the participants. You have explained nice, and also you have highlighted the key takeaways. What are the things that they should learn in this thing. So I should appreciate Dr. Raju. It is very pro for the participants. Thank you very much. Now, only one or two questions are there, Dr. Raju. So
please, sir, please.
So that very simple thing that one madam has written, please explain the examples of PHEOC.
Okay. Thank you very much, ma'am, for the question. See, PHUC is nothing. It's a structure that is there in existence. You can say an office where different stakeholders come and sit together. It can be permanent, it can be temporary, it can be, like I said, there are different types. It can be permanent. So basically, you can think as an office where you continuously monitor some situations. It's an emergency operation centers where it's like a monitoring cell. Like take any example, but there will be representative from various stakeholders. There will be from line department. There will be health expert from disaster management. There will be expert from public health emergencies, so that in any situations they can work together. They are there on the field and immediately they can take action, so that the situation that is reduced immediately as soon as that the problem or the emergency occurs. So this is basically that, ma'am.
But she is also writing that is it type A, B, or C, that type.
Okay, so that depends. That depends based on your locations, based on your need. Because as you go from type A, that can be at the it's a district or state level. Type B means this is more integrated, where you have more stakeholders who comes in and pitch in. That will be at the national level. And the type C type, it can be international or sub regional level. So based on the locations, the need, it varies from type A, type B, type C.
Thank you, Dr. Raju. Nicely
you,
you have
sir.
explained and beautiful answer to the
Thank you, sir.
these appropriate questions. Okay, then without further delay, then we'll go for the second lecture, because already that expert for the valedictory, Professor Pant, is joined. So it is a great moment for us that we'll be addressing our valedictory sessions. Now I welcome also Professor Pant in this session. Now, Dhaneshwari, it is hand over to you. Dhaneshwari, are you there?
Hello, hello. Am I audible, sir?
Yes, yes. So please carry on.
Okay. Now I would like to invite our next expert, Dr. Ankit Tandon, for the second lecture of today's session. Today he will be delivering his talk on the topic Recent Trends in Extreme Precipitation Events over Indian Region. So a brief introduction about him. Dr. Ankit Tandon is an atmospheric scientist. He has completed PhD in New Delhi. He is currently associated with Central University of Himachal Pradesh as a faculty member in Department of Environmental Sciences. Tandon has been a visiting research scholar in North Carolina State University, US. Also, in important research on atmosphere from Joseph University, France. Overall, he has 40 years of post-PhD research and teaching experience. Apart from all these, he has also completed research projects from various funding agencies like SERVDS, NITI Aayog, and TSTEP, etc. Presently, he is a project partner in an Indo-Swiss international collaborative project. He possesses excellent track record of publishing top quality publications, acquiring external fundings, and thus contributing in the field of atmospheric sciences and climate change. So, on this note, I would like to hand over the stage to you, sir. So, over to you, sir.
Am I audible?
Yes, sir, you are.
Halda sir, please give me the right to share my screen. So is my screen visible to all of you?
No, Dr. Ankit, it has to come. It is starting.
Okay, sir. So anyways, first of all, I would like to thank
Dr. Ankit, your voice is not coming. Hello. Dhanasri, could you hear me?
Sir, I can hear you.
So,
I think,
are you getting the voice of Professor Dr. Ankit?
Sir, I don't know before it's saying it's audible. Even it's now coming again, starting to share content, but it hasn't appeared on the screen yet.
Dr. Ankit, you can put it off that presentation and again you restart. It may be some problem in his that network or say this system maybe.
yes,
Yes,
yes.
sir.
Please put it off, Dr. Ankit. Now in your desktop you open fully, then up through the share button, then you please click it. Is it hanged in your system? Participants, sorry for this inconvenience. Now, definitely Dr. Ankit is trying a level best. So he'll be coming shortly with us. Dr. Ankit, could you hear me?
So I can hear you. I think I am facing a network issue.
Okay. Now, in that case, you can pass on your PPT to Dhaneshwari. She can continue, or you can send it to me also.
So now my screen is visible to all of you, I think.
No, no, not it is coming. No, dear, it is not. You please mail to me as well as Dhaneshwari also. Either one of us will put your this slide. Dear participants, we are sorry for that. Shortly, we'll be coming because Dr. Ankit is facing problem in his internet. Now he's sharing, and definitely we'll make it shortly. Dear participants, I want to tell that regarding the download of the certificates, yesterday one gentleman has asked me that how we can get the certificate. Please tell me the procedure. That those who are frequent joining in this program, in this NIDM program, they know they are expert, but some of the newcomers, they may face the problem. What happened that you have to go to the site through where you have enrolled. In that site, you please go for the filling of the feedback. After filling of the feedback, then the option will be coming for the certificate. Now, for that, for having that certificate, criteria is there. First thing, you have to enroll the program. Without enrolling or registration, you cannot expect the certificate, number one. And number two, you have to attend at least 60% of the whole time. Say 2 hours is there, then 60%. 60% means that out of that 1 hour, you have to 24 minutes, not 24, 36 minutes, again 30. So 72 minutes in a day of all 3 days you have to attend. Then and that you can expect the certificate. So these are the two preconditions to have the certificate. And certificate will be automatically generated, not manually. If you are having attendance 60% of the time, all 3 days, you will get it. If you are registering or enrolling, you will be getting. So these are the things you have to keep on mind, that our regular visitors or regular participants, they are not facing any problem. The newcomers may be facing problem, no matter, but you have to ensure your attendance and you have to ensure your enrollment. And automatically it will be generated, not by manually. So this is the things I should make you aware. That's why I'm telling. So just again, Ankit will share that thing, then immediately I will continue.
On behalf of Central University of Himachal Pradesh, we want to apologize to all of our participants as our university is facing issues from the past few days. So I hope within few minutes, Dr. Amit Tandon will be able to join us. So you are requested to be with us. He will be joining shortly.
After this session, we'll be arranging this valedictory program of what happened last 3 days, including today. And also the valedictory remarks will be given by Professor Deepak Pant. He is with us. He is in this stage. Now, after completion, due to this inconvenience, we are very much sorry, but still he's trying in some other means. Yes, I have received his PPT. Now, just 1 second. Yes, Dr. Ankit, could you hear me? Dr. Ankit, could you hear me? Hello? Haneswari?
Yes, sir.
Yes.
Yes, sir.
You're getting my voice now?
Yes, sir, I'm getting your voice.
And also you have
Even the
seen that?
first screen was, yes, the first slide was visible, but
Yes.
has become disappeared now also.
Now let Dr. Ankit should respond. Dr. Ankit, if it is not working, so please start through your mobile. Can you convey, Dhaneswari?
Yes, sir.
Yes, sir. Yes, sir.
Are you getting my voice now?
Okay,
Yes,
okay.
sir.
Now
We are
I'm,
getting your voice now.
now I'm sharing your PPT. I hope it is visible.
No, sir.
It is not coming.
Not yet. No, sir. Not yet.
Now what happened? Presently it is coming.
Just showing National Institute of Disaster Management course. It's not showing the slides.
Now it is
I-
coming or not? No.
No, sir. No, sir.
That's
We
what.
would like to thank all our participants for your patience.
So it is not coming, huh? Okay.
No, sir, not right now.
Just 1 minute.
We want to tell you that this is the last lecture for this session, and after that, the validation session will be completed, addressed by Professor Deepak Pant, as Professor Mahajan would not be able to join us today because of his related interview. So I think in 2 minutes, Ankit would be able to join us.
Actually, my sincere apologies. I inquired from our university administration. So they informed me that it is a kind of blackout from BSNL side. So we are using the BSNL network. So it's a kind of like disaster at the right moment.
Now it is coming.
Yes, sir.
It
Yes,
is
sir,
there
we are
now?
able to see it. Yes, sir.
Okay,
Yes, sir.
let
Now
it be
it's
continued
visible.
like this. If I'm going for Zoom, then problem is there. So okay, let it be continued like this. Yes, Dr. Ankit,
Sir.
please continue. Please continue.
Okay, thank you very much, sir. Again, my sincere apologies for all these disruptions. It is somehow very, very unexpected. So we got this problem from BSNL side. So for this particular training program, I decided to talk about something about the recent trends that we are observing in the extreme precipitation events over the Indian region, and particularly over the northwestern Himalayan region. So there are, sir, can you please move the slide?
Yes. Is it visible? Second slide.
Yes, sir.
Necessary? Is it
Yes,
visible?
sir, it's visible. Yes, sir, it's visible
Necessary,
now.
please click the photo whenever it is required, because I cannot do. Okay, please.
Okay, sir.
Ankit ji, could you see the second slide? Mr. Ankit, you please start through your mobile. That's all.
I am connected from my mobile itself.
Yes,
So
yes,
anyways,
please.
we can define extreme precipitation events in two different manners, based upon the frequencies and based upon the magnitude itself. Nonetheless, extreme precipitation event is basically a measure in terms of relative or absolute amount of annual rainfall delivered by a single day precipitation event. So, so in terms of frequency, we can say the topmost 1% of the precipitation events, those are taking place over a particular place in a particular year. In terms of magnitude, we have different classification given by Indian Meteorological Department. And why it is important to study extreme precipitation events, because we are knowing that increase in the intensity or frequency of extreme precipitation is a key factor that affects the risk of flash floods and landslides. In certain very grim circumstances, it can be manifested in the form of a cloud burst also. So look at the average distribution of rainfall from 1901 to 2021. It basically shows that the extreme rainfall events are really very rare. Even then, the monsoon of this particular year has witnessed the second highest extreme rainfall since 1902. So with this scenario, please the next slide.
Yes.
So India is one of the most vulnerable region in the Southeast Asia, which is highly affected by the climate extremes like floods, drought, and heat waves. And out of these, the floods and flash floods are happening in some pockets of the Indian subcontinent, particularly in the hilly terrains or in the coastal terrains. And apart from that, the central part of India is also witnessing some incidences of extreme precipitation. The extreme precipitation events led to profound flash floods and landslides, and we can define extreme precipitation events is the one in which rainfall over some specified time period exceeds some reference threshold. So as I said, that we can define extreme precipitation events in two different manners based upon the frequency distribution itself, or based upon the absolute magnitude of the daily cumulative rainfall. So the more important in terms of disaster and disaster risk reduction is to know about how the magnitudes of these extreme precipitation events, you can say the topmost 1% of events changing in due course of time. So here I'm going to share our work for the recent changes that has been happening in the Indian subcontinent, especially over the northwestern Himalayan region. Next, please. The next slide, please.
Yes, it is not visible. It is not visible, Ankit.
So the so if we go back to the history of this particular branch of atmospheric science, where workers used to study the characteristics of rainfall, more so the extreme rainfall, leads to a kind of conclusion that it is only after 1950s or only after the rapid industrialization and with the other anthropogenic influences that we are witnessing more and more events of extreme rainfalls. So as Indian rainfall system basically responsible for the livelihood of around 1/6 of the world population, it is pertinent to study in the long-term variability or long-term changes in the extreme rainfall events. Significant increasing trend in the magnitude and frequencies of extreme precipitation events have been reported, particularly during the Indian summer monsoon rains over the last 5 decades by the legendary worker Dr. B.N. Goswami ji and other workers also. And as far as the history or the historical background is concerned, then the maximum spatial change reported to occur after 1975. Next, please. So in terms of magnitude, daily rainfall or 24-hourly accumulated rainfall can be classified in 6 different categories. Very light rainfall, where the accumulated 24-hourly accumulated rainfall is less than 2.4 millimeter. Light rainfall when it is less than 15.5 millimeter. Moderate rainfall when it is less than 65 millimeter. Heavy rainfall when it is less than 115.5 millimeter. Very heavy rainfall ranges between 115 to 205 millimeters, and extremely rainfall or extremely heavy rainfall has been categorized when the 24-hourly accumulated rainfall exceeds this particular threshold of 204.5 millimeter. Next, please. So now, what is cloud burst? The cloud burst, according to the Indian Meteorological Department, a cloud burst features a very heavy rainfall over a localized area at a very high rate of the order of 100 millimeter per hour, featuring strong winds and lightning. Actually, such a kind of meteorological phenomena is happening in remarkably a very small area of the order of 20 to 30 square kilometers, and that is why we are mentioning it as a very localized phenomena. And why it is happening and where it is happening, we are observing or we are witnessing cloudburst not over the entire geographical area of Indian subcontinent, but over few pockets of it, where the precipitation is dominated by the orographic precipitation, like in the Himalayan region or northeastern states or in the Western Ghats. So what is happening? The cumulonimbus convection or convective conditions are prevailing over there, where the moist thermodynamic instability is developing very deep. Very rapid dynamic lifting is happening by the steep orography, and that basically culminates in a very sudden and very heavy downpour of the order of over 100 millimeter per hour. Next, please.
Do you get it?
Next slide, please.
It's not coming?
It is.
No.
It is coming. So how can we study? So to study extreme precipitation or extreme rainfall events, obviously we need to have data sets. We need to have some kind of statistical tools or indices. We need to have some kind of statistical tools to analyze those indices. So starting with the data sets, if anybody interested in studying extreme precipitation events, then he or she should get this particular review article handy, because this article provides a very comprehensive information about the different types of precipitation data sets available globally. Next, please. So as far as the precipitation data sets are available, there are 4 different categories of precipitation data. Number 1 is the point data or the rain gauge data maintained by the different meteorological agencies worldwide. In India, Meteorological Department is responsible for that. Then the same meteorological agency can provide you the surface observations, the rain gauge observations, but in a form of homogenized data. In homogenization process, what we are doing, we are interpolating the rain gauge data. Those are dispersed, or those are the rain gauge stations. Those are dispersed or scattered all over a particular geographical region. In the interpolation schemes or the homogenization schemes, the main point of consideration is what kind of climate is basically there over a particular region, and that is why homogenization is taking place over different kind of climatological divisions. Then the next is the satellite-based data. Satellite-based data sets, there are various satellite-based data sets are available. Next, please. And these data sets are basically a product either based on the IR sensors or the microwave sensors. And the third one is the reanalysis data. Reanalysis data are basically based upon the computational models, or you can say the weather research forecasting models, different types of regional climate or weather research forecasting models, where the parameterization schemes are very, very specific for a particular kind of climatic division. So there are different reanalysis rainfall products also available to conduct such kind of a study. And lastly, we have a kind of merged data. Next, please. So the merged data are basically, they are the product of the merging of two different sets of data, ground-based data as well as the satellite-based data, after their intercomparison and recalibration. So to study extreme precipitation events, as I said, that it is a kind of event that is happening over a 24-hourly time period or less than 24-hourly time period out of the total annual span of precipitation. Means out of suppose 250 or maybe more than rainy days, so the top 1% rains in terms of the magnitude, those we are taking as extreme precipitation. So we require daily rainfall data set, and that is why there are specific data sets or products that we need to use to study extreme long-term variability or the change in the characteristics of extreme precipitation events over a particular geographical region, here the Indian subcontinent or so. Next, please. India Meteorological Department is also providing a very, very detailed and very long time series data set of 0.25 to 0.25 degree latitude, longitude spatial resolution on its website. Anyone can download it. There are different data products as far as the daily rainfall is concerned, and use these data sets for their specific studies on the extreme precipitation events. Next, please. So using all these data sets, what we need to do, we need to harness or we need to use some specific indices to study the long-term changes in the extreme precipitation events. These indices has been recommended by an expert team on the climate change detection and indices, ETCCDI. There are 11 such indices, right from the monthly maximum one-day precipitation to monthly maximum consecutive 5 days precipitation to simple precipitation intensity index. Next, please. Then annual count of days when the precipitation was more than 10 millimeter, or annual count of days when the precipitation was more than 20 millimeter. Next, please. And likewise, like you can set a particular threshold and just count the number of days where your annual total rainy days exceeds that particular threshold, the 24-hourly cumulative rainfall. Then the maximum length of dry spell, this is not pertinent here. Then maximum length of the wet spell. that like consecutively how many days it was raining over a particular place. Then the annual total precipitation, when the precipitation exceeds your 95th percentile and likewise the 99th percentile. Next, please. And lastly, the annual total precipitation in wet days. So these are the indices people used to use. Uh, Generally, we are using a kind of combination of both both the uh, two, two, two different approaches, like in terms of frequency as well as in terms of magnitude. So we are putting both the filters. We are actually just extracting out the information of, say, the topmost 1% of rain events when it crosses a particular threshold. So in a very specific sense, it is the 95th percentile, and when the 95th percentile crosses a specific threshold, be it say 50 millimeter, be it 75 millimeter, 100 millimeter, or 125 or 150 millimeter. We have already seen that how we can classify a daily 24-hour rainfall in different categories based upon the Indian Meteorological Department classification. Next, please. So we have seen different types of data products, or like either the real gauge data, or homogenized data, or reanalysis data, satellite data, or the MERS data. But specifically speaking, it is really very difficult to have a rain gauge station over the entire geographical area of such a vast country like India. So we are having a limited number of rain gauge stations, and that is why we need to use or harness other products, be it the reanalysis product or satellite or merge product. But these products are, before using these products, we need to evaluate their performance for capturing either the average or the extreme rainfall events. And to do such a kind of performance evaluation analysis, we are using few tools. Either we are using a tool known as root mean square error. So basically, what is this? It is like squared departure of the reanalysis of satellite or merged product from the observed data, that is the rain gauge data. Then we need to take the mean of that and need to take the root of that. So more is the RMSC, the more will be the departure. Same as the scaled percentage bias. And the third one is your data concurrence index. So what is the data concurrence index? Whenever the trend that has been observed on ground, and the trend observed in your reanalysis satellite or merge data, if both the trends are statistically significant, then we are putting a kind of weight 1 before that. Or otherwise, if one is significant and another is not significant statistically, then we are putting a 0 over that. And in this particular manner, we are calculating this data concurrence index. And data concurrence index give us a kind of feel that how different types of data products are basically giving information as far as the change in the precipitation or extreme precipitation is concerned over a particular place. Next, please. So here you can see the performance evaluation of different daily rainfall data sets. As an example, over 4 different basins in the northwestern Himalayan region. The Chenab Basin, the Ravi Basin, the Bias Basin, and the Satluj Basin. And there are different data sets along with the IMD homogenized data set. And the the point we can make out of here is that different data products behave differently over different river basins or sub basins in comparison to the surface observations done by IMD or the homogenized products available with IMD. Next, please. Similarly, you can see here the performance evaluation of different daily rainfall data sets over the northwestern Himalayan region. And here we have compared the two different types of data sets. One is our surface data set provided by the India Meteorological Department, and the satellite data set, that is the TRMM data set. TRMM data set is the most sought after, most recommended data set, most recommended satellite data set to study long-term changes in the characteristics of rainfall over different places. But here also you can witness that there is a significant root of mean square error exists over different parts of the northwestern Himalayan region, as well as there is a significant percentage bias exist. Even then, we need to take a best compromise, and we need to harness the best available reanalysis satellite or merged data set to study long-term changes in the extreme rainfall events. Next, please. One more. Is my voice clear? I'm audible?
Yes, you are audible.
So in the slide number 20, actually, here I wanted to share our work in a very summarized manner, titled Spatio-Temporal Changes in the Extreme Precipitation over Indian Subcontinent during first 2 decades of 21st century. Next, please. So in this particular work, what we did, we basically used the TRMM daily rainfall data product with a resolution of 0.25 to 0.25 latitude and longitude. Then we utilize a single indice that is P99, and that P99, and then the threshold, we put a threshold over it, or different thresholds over it, be it 50 millimeter, 75 or 100 or 125 or 150 millimeter. So in the present slide, what we can see, like for our study, we have divided the whole Indian subcontinent geographical area in climatic divisions. So there are 6 different climatic divisions: North India, West India, Central India, East India, South India 1 and South India 2, and then the Burma Myanmar region. So if you look at the extreme left corner, the big panel. So here we have plotted the annual total rainfall, and we all are aware that the annual total rainfall is maximum along the west coast, along the western Ghats, and in the northeastern Himalayan region. Then on the right 4 panels, on the right side, B, C, D, and E, we have plotted the total rainfall in different seasons. And again, it is but obvious that the maximum amount of contribution is coming during the 4 months of Indian summer monsoon, that is June, July, August, and September. For rest of the 3 different seasons, we are not getting that much amount of the total rainfall. Then after this particular Indian summer monsoon season, we are getting some significant amount of rainfall in the pre-monsoonal season, particularly in the northeastern region, and in the winter season in the northwestern Himalayan region. Next one, please. So in this particular slide, we have plotted the P99 value of 99th percentile of the annual rainfall averaged over the study period, that is for the 2 decades, over different grid cells. And from here we can very easily observe that the amount or the magnitude of P99 is more along the west coast and along the Western Ghats in the northeastern region and in the Burma Myanmar region. For rest of the region, the magnitude of P99 is not that much. Next, please. So as a result of our analysis that we carried out over the daily rainfall product by TRMM and the P99 of the annual all the annual wet days, what we observed. So for the deducing the change or the trend, we used a non-parametric test, that is the Mann-Kendall-Whitney test, and to estimate the magnitude, we utilize the Thain slope method. So what we can observe that for the P99 having a threshold more than 150, we observed that in the last 2 decades there are positive changes taking place along the west coast, along the Maharashtra or the Konkan coast, along the Saurashtra coast, and along the Burma Myanmar coast. It is interesting to observe that for the moderate rainfall or with the moderate threshold of 75 millimeter or so for the P99, there are positive changes taking place over the northwestern Himalayan region, and more interestingly over the Rajasthan part, like Malwa region of at the boundary of Rajasthan and the Madhya Pradesh. As far as the seasonal distribution of these changes are concerned, then these changes are mainly happening in the monsoonal season, in the months of June, July, August, and September. But there are some changes we can witness in the winter, like that is the DJF and the pre-monsoonal time period also. Next, please. As far as the negative change is concerned, then the negative change is generally happening in either the moderate or not very heavy rainfalls with the threshold more than 50, more than 75, and more than 100. And the spatial domain, it is happening in the the tail part of the Indo-Gangetic plain and along the eastern coast, along the central Indian part, and the seasonal expanse is mainly happening in the monsoonal months. One thing interesting to note here also, like in the month of December, January, and February, in the panel B, we can observe that as far as the P99 above 50 millimeter or above 75 millimeter is concerned, then there is a negative change happening along the northwestern Himalayan region. So next, please. So in crux, what we can say from this particular study, that the positive changes for the heavy as well as the very heavy extreme rainfall observed in this study over the coast of West India, west coast of South India, and some part of the central India. The attribution could be done to the low level of monsoon westerlies and the increased vertically integrated moisture transport from the Somalian coast towards the West Indian coast. Additionally, both positive and negative changes in different absolute threshold can further be closely linked to the weakening of northerly winds. The continuous increase in the convective activities has also been attributed for such kind of observations. Then it is also interesting to note that there is a shift in extreme rainfall observed in the winter month towards the post-monsoonal month, and it could be attributed or it could be associated with the increased frequency in the extratropical cyclones or the western disturbances in recent years. Next one, please. So coming to the specific northwestern Himalayan region, here we harnessed both the data sets, Indian Meteorological Department daily rainfall homogenized data set as well as the TRMM data set. And here we utilize one more advanced tool to detect the changes in the extreme precipitation events. Next, please. So we utilize quantile regression analysis to detect the changes in 3 different indices. Number 1 was the total rainfall. Number 2 was the number of rainy days, and number 3 is the simple daily intensity index. So in the total rainfall, what we can observe that on the annual basis, there are significant positive changes happening in the upper tails in the Trans-Himalayan as well as the Cis-Himalayan region. As far as the seasonal distribution of this particular trend is concerned, then again it is like this particular analysis is also corroborating our findings in the previous work, and that is there is a shift from say December, January, February to March, April, May. Next one, please. So the total rainfall increasing in the northwestern Himalayan region, particularly their upper tails, but the number of rainy days has been decreasing. So this mustard color, these mustard color patches are basically representing the significant negative change in the quantile regression. And next, please. So in combination of the above 2 results, what is basically happening that the intensity of rainfall are manifested in the form of simple daily intensity index. So the daily intensity index is again showing a significant increasing trend in both the Trans-Himalayan, Greater Himalayan, Trans-Himalayan, as well as the Cis Himalayan region. Next, please. So in conclusion, what we can say that this particular work in the northwestern Himalayan region basically validated the good performance of TRMM in comparison to Indian Meteorological Department surface observations. A spatial pattern of total rainfall variability over a study period observed revealed a kind of variability increases with increase in latitude and elevation. So positive change in rainfall and rainfall extremes were observed over the northern part of study area, where as the Greater Himalaya showed both negative and positive change intermixed. The positive change in the rainfall magnitude and negative trends in the frequency resulted in the increased rainfall intensity over the northwestern Himalayan region. Our findings also revealed that the extreme rainfall over the study region was increasing at a higher rate of change as compared to the average rainfall. Means the higher tails are increasing with the higher rate, whereas the average or the tau is equal to 0.5, that is the median trend is not increasing with that particular pace. season-wise trend analysis suggested a shift in the rainfall and the rainfall extremes from winter to the post-monsoon season. Next, please. So, in a kind of takeaway message from both of these studies and this particular presentation, what was basically need to be done, that we need to perform future research work using regional climate models for the better understanding of ongoing changes in the rainfall and extreme rainfall pattern. Why? Because different data sets are giving a different performance evaluation results. So though we have used a uniform data set, that is the TRMM data set in these previous works, but as a suggestion, what we should do, we should evolve or devise uh, 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 an evolution that can first of all perform an analysis of performance evaluation of different data sets for different river basins or the sub basins, and then we should go for the change detection and the attribution. Changes in the rainfall and rainfall extremes would have serious implications on agricultural practices, food productivity, infrastructure. We have seen the washing off of different national highways, etc. In this particular year in our northwestern Himalayan region or northeastern Himalayan region. Then what is again required is the policymakers and natural hazard management authorities to help build adaptive environment, especially over these regions. Those are vulnerable to rainfall and rainfall extremes. Lastly, since ground observations in the Himalayan region are highly sparse, it is thus advisable for the authorities to build a more uniform and denser network of ground-based observations over this region. And this would not only enhance the accuracy of hydroclimatological analysis, but also lead to the betterment of early warning and weather forecasting system. Next, please. Thank you. Thank you all. Questions, if any. And once again, my sincere apologies for the glitches on account of the network failure at the Central University of Himachal Pradesh. Thank you.
Thank you, Dr. Ankit. It is a very good deliberation and it is a very statistical work. You have shown and you have a lot of publication. You have also mentioned the good quality of work you have done. Especially, you have mentioned in your region that is from very low to extreme precipitations. As per your observation or as per your findings in that area, that you are getting rainfall second highest within the 120 years, say 1902 to 2022. You are seeing the second highest rainfall. Of course, it is the northern part of India, but whereas in the central northern part is having very, very lacking in this year, the rainfall. But it is no matter that rainfall varies from area to area, and nowadays it is extremely visible in other things. And you have also explained the cloud burst phenomena, that in terms of quality of rain, quantity of rainfall and in the area. And also performance evaluation of different daily rainfall data system you have provided, you have explained, that is in 4 basins: Chenab Basin, Ravi Basin, Beach Basin, and Softwoods. From there, after having lot of data, you have statistical analysis you made, and also after that, you validation also made. Very good work you have done, very research work, very nice research work you have done. But it is a very technical paper. Okay, ratherless, it is a very good thing that our test should be changed, that our participants should get different kinds of work and different kinds of findings from different scientists. So it is one of that. Very good presentation is there. Now, Dhanashree, I would request, so please see if any question is raised.
Yes, sir, sure. As of now, I'm able to see only one question from the participant related to this presentation, and it is climate change is the reason behind the cloud burst or not? Ankit sir, can you hear us?
Yes,
I
I can.
I repeat, the question is climate change is the reason behind the cloud burst or not?
Okay, am I audible?
Yes,
Yes,
sir, you are.
Okay, so partly yes and partly no. So partly yes is because of the climate change. What is happening? There is a shift in the availability of moisture over a particular place, and when this availability of moisture in a region where we can have very deep like cumulus or cumulonimbus convective conditions prevailing with a steep orography, then obviously we can relate the cloudburst events with the ongoing climate change, but not with a very significant confidence, because still like lots of studies need to be done. We need to find out the real cause using weather research forecasting modeling over that particular place where this cloudburst event is has happened or is are happening.
Yes, nicely explained. Obviously, due to the climate change, that during the summer time in the say sea and other area, so due to the heat time, that atmosphere within that cloud or the moisture is increasing, say 0.5 degree temperature enhancement, so at least 3% of more moisture is accumulating. So those moistures are in turn is giving some impact in one or other regions. So that may be the one cause. I hope you have explained nicely. Dhanashree, if any other things, any other question is there? If not, then we can close this session.
Yes, there are no other questions in the chat box. There's only one comment from Professor Dr. Manavalanji. Thank you so much, sir, for your beautiful and encouraging comment. So, Helder sir, there are no other questions. So, I guess we can move towards the valedictory address.
Yes, please.
Yes.
Now, dear participants, the technical session is over. Now we'll be going for the valedictory session. Now, before hand over the dash to Dhanashree, I will say that 3 days brief. That is, within 3 days, that first day there were technical, very appropriate technical session were there. That is from the disaster management support using satellite remote sensing data from the NRSC. He has given a good visualization of the satellite remote sensing data, how it is helpful for the various kinds of disaster and their data bank management. Thereafter, Professor Mahajan, he talked about seismic hazard status of Northwest Himalayan region and rail of site application. He has explained in that area of Himalayan region that how the seismic activity and hazards are taking place, what are the causes and what are the role, so far the damages, all the things. After that, on that day, that landslide, that is GIS-based mapping and landslide hazard zonation map taught by Dr. Harjit Kaur. He has given Sikkim and in that area, all those GIS, GIS kind of analysis he has taught about, and he talked very nicely, briefing he has given on landslide in Sikkim area, Sikkim and Ladakh. Sorry. After that, in the second day, again the seismic study that was through the geoinformatic application for seismic study and different case study was taught by Siva Kumar from Chennai, that is SRMIST University, and that was with the use of this geoinformatics, how the seismic activity, especially for the geomorphology and other activity, and this morphometric analysis, how it could predict and what are the epicenter, a lot of things. And also he has shown a GIS customization software that can predict the epicenter and other things. And nicely he has explained in his talk yesterday. That after that, that one cyber disaster risk reduction, that lecture was there by Wing Commander K. Venugopal from Global Head ISAC Aero. he has given a very beautiful in the morning. During recapitulation, I talked about that, what he said in that he has given details, basics of cyber disaster, cyber security, do's and don't do's, in addition to the disaster recovery plan. He has given the overview of cyber disaster management. Apart from all these, he has given the glimpses of developing a cyber preparedness plan and also talked about the cyber terrorism as well. So all the things he talked very nicely. After that, final paper was there yesterday, that is third paper, that was a forest fire in India, recent trends and in incidents and causes. For that, he talked all over the India's scenario, and that is Vinita Kumari from our colleagues, NIDM. He has given a ventures of forest fires in all over India and different kinds of phenomena what are happening in there. And today, thereafter, yesterday it was over 3 sessions, and today we had the 2 sessions. First thing is taken by Dr. Raju Thapa, Technical Officer from Emergency Management, VHS CDC. He talked nicely regarding the public health emergency management. He has given a pro knowledge for our participant, what we should do in health emergency management, especially for the public, what should be done, what they should gain. He talked beautifully and very nice presentation was there. After that, Professor Ankit, he has talked the recent trends in extreme precipitation events over Indian region. What he has given just now, I have briefed. So these are the deliberation in over the last 3 days. We have tried to capture all kinds of natural events and natural disaster, as well as some man-made disaster also. It is there, we made it, and how it could be, the risk of disaster could be assessed, and as well as how it could be managed. Nowadays, I know each and every university, they are having this disaster management cell or disaster management activity. They are publicizing to the persons, citizens, and what could be the remedial measure, preparedness, mitigation plan they are giving, and also they are giving the sorts of capacity building also to manage this disaster work in here and there, especially for the public. And also early warning system in India, in different, except earthquake, all we have managed to have the early warning, and also we are transmitting to the public so that saving could be made, fatalities could be reduced in this way. So this was what I feel that what was our objective. We could cater in collaboration or in coordination with the Central University of Himachal Pradesh, Dharamsala. We had a very nice collaboration and beautiful presentation and support from their each and every staff. So with this, I close. Now I hand over the stage to Dhaneshwari to request this professor, and I welcome also, sir, Professor Deepak Panji. I welcome in a short notice. We have requested you to participate in our valedictory sessions, and you have accepted. We are very, very pleased on that, and it is your matter of prestige that you will be addressing. In this valedictory session over this program, that was 3 days online training on disaster risk assessment and management with your university. I know that Professor Pant is an eminent scientist. He was the ex-head and dean of School of Earth and Environmental Sciences of Central University of Himachal Pradesh. With this, I request Dhaneshwari, so please provide the stage to him. Before that, you please put his introduction, or may I request this Ankit to provide his introduction. So Dhaneshwari as well as Ankit, both I am hand over to you the stage. Please continue.
Thank you very much, sir. Am I audible, sir?
Yes, you are audible.
So it is my privilege to introduce Professor Deepak Panji, who is professor in School of Earth and Environmental Sciences, Central University of Himachal Pradesh. Professor Pant is also a visiting professor of environmental chemistry and chemical sciences in Indira Gandhi Technical and Medical Science University, Arunachal Pradesh. Professor Pant has done his PhD from Kumaon University in Nainital, and after that he was involved in research activities in Dehradun before joining the Central University of Himachal Pradesh in 2012 as associate professor. Professor Pant received Visitor Award 2017 by Honorable President of India for his innovative research activities. So it was conferred as the Best Innovation Award in 2017. Professor Pant also a recipient of National Award for Technology Innovation by the Ministry of Chemicals and Fertilizers, Government of India, and this award was conferred to him by Honorable Vice President of India. With all these allocates, Professor Pant has a long list of different awards like INSA Visiting Fellow Award or DST Young Scientist Award from INSA as well as the DST, or the Uttarakhand Young Scientist, Uttarakhand Council for Science and Technology Young Scientist Award. So Professor Pant became the professor in the School of Earth and Environmental Sciences in 2015. So he has more than 20 years of teaching and research experience. His research work is basically centered around the development of hybrid compounds and hybrid methodologies to solve different environmental problems and environmental issues spanning from the solid waste management to the toxic and hazardous waste management to the climate change. He has successfully guided a number of MPhil and PhD theses and the MSc dissertation student. He has more than 50 international publications with an H index of over 18. So all with these words, I would like to hand over the dice to Professor Deepak Pant sir for his valedictory address. Professor Pant sir.
Thank you, Dr. Ankit. Am I audible?
Yes, sir. Yes, sir. You are audible. Very much. Nicely.
Okay. So I congratulate you all for this wonderful 3-day online training program on the disaster risk assessment and the management. This is organized by NIDM. NIDM is a principal governing body behind that, and with our university. Actually, in fact, when I tell about the disaster, they are some my observation. I have certain different view to see the disasters. Actually, the damage caused by any natural disaster will be more intense due to the man-made vulnerabilities. So actually, the man-made, the anthropogenic events, there is no proper database, as per my best knowledge, to assess the disasters. So there is always a need of the database for the estimation of human interventions. How human is going to be intervene towards our this aquatic biota, environmental biota. So this need to be done. Human intervention database can be an important tool to estimate the disaster vulnerabilities. Actually, all the way there is a human if and the vulnerability if one can wish to assess before, then there should be certain kind of such data. Second, in my opinion, that the catchment area mapping in the major urban area, there should be a requirement of certain catchment area mapping, and its divergence over time is an important tool for estimating the water waste kind of disasters. Actually, what is going to be happen? There is a very limited data. In fact, if you see about the any natural water sources, what is actually the catchment area, the how any kind of this pollutant can be interrupted over there, how it is passed to there. So they are, in my opinion, this is a limited data available and need to be work on that particular direction. And very important that change in the urbanization pattern. One should be think about this particular world, that the urbanization pattern is need to be required for the disaster assessment. As there is going to be change, our villagers are going to urban areas, and there is change over this population pattern all the way. The urbanization pattern is all the way very important. Uncontrolled urbanization always affect the environment in many ways. Like if the population is going to be dense in a one area and this is very spreaded in one area, so that result come to the form of many disaster. So in fact, landfill sites of waste is going to be ignored. In fact, nowadays, like this Delhi, the Silampur area and the Gazipur area, landfill sites can be responsible for many kind of disasters. So anyway, there is I think there is no available database or diesel site or the mappings of these catchment area out of these landfill sites likewise. So it is a requirement. In my opinion, there is a requirement for do such things. So overall, there is need for a disaster vulnerability map by involving these factors like the principally the urbanization pattern, the landfill sites for the waste. It is most important. So it is required for the. It is also required for a sustainable industrialization and the risk assessment, disaster risk assessment factor. So this is my opinion in this area. So actually, in my opinion, also such kind of training sessions are actually very much required nowadays, because our student, our audience should be aware about the current unprecedented scenario of disaster happening almost the every part of the world. Especially having the awareness about the disaster is very much more needed in the hilly terrain. Like we are in the hilly terrain, there is a much more kind of problem, specific problem, Himachal Pradesh or Uttarakhand like districts, states. So mountains are fragile, having the fragile ecosystems. So I hope this training program, the discussion expert discussion would be very much helpful for the audience, our students, our the participants. So in this area, I also happily wish to share that our department, our university, is recently started a course on the disaster management and the diploma course. Sorry, it is a diploma course on the disaster management. So I hope it will help to us also. So at the end, I would thanks to all the NIDM officials on the screens who are involved in organizing the program. Dr. A.L. Haldar, especially who has been such a wonderful host throughout the sessions. Dr. Ankit, our Dhaneswari Sharma, who very wonderfully host the program. Once again, a big congratulations to the NIDM or our department, especially our university, Central Institute of Himachal Pradesh, for organizing such event, and hope in future we also organize such event. Thank you.
Thank you, sir. It's a very nice information you have given, and whatever points you have observed and you have highlighted, those are very, very appropriate things. This urbanization and catchment area, and also this vulnerability map. These are the things and need of the hour. It is required, and very appropriate things you told. And it is a thanks that you have given a good luck to us, and nicely we have performed with your blessings. And in future also, we'll try to do our best level. So we are very pleased. We can see you in the last event, and you have done your appropriate job. Thank you once again, sir. Now I hand over to you, Dhaneswari ji.
Okay.
Dhaneshwari, could you hear us? Okay, no matter. Now Ankit will go for the last activity, that is the vote of thanks. So I feel that it is, you can perform this vote of thanks for the closing ceremony. Please,
Thank you.
Ankit, please.
Thank you very much, sir. So, is my voice clear?
Yes, yes, it is coming.
So, it is really a privilege and a great joy for me to extend a formal vote of thanks to all those who have contributed in one way or the other to carry out this training program, 3 days online training program, organized by Nation Institute of Disaster Management in collaboration with Central University of Himachal. Ladies and gentlemen, first of all, I would like to convey our profound gratitude to our patron, Sri Taj Hassan ji, Executive Director, National Institute of Disaster Management, and Professor S.P. Bansal ji, Honorable Vice Chancellor, University of Himachal Pradesh. It is their guidance and blessing that we have been able to conduct this 3 days online training program. Their words have always been a source of inspiration for both the institute in pursuit of excellence. Of due to sincere acknowledgement to our chairperson, Professor Surya Prakash ji, at GMR Division, NIDM, and Professor A.K. Mahajan ji, Director IQAC, as well as the Secretary to Honorable Vice Chancellor, Central University of Himachal Pradesh, under whose leadership we are conducting this 3 days online training program. If the program today has been carried out even to its smallest detail, it is all because of that. Our wholehearted thanks to Professor Deepak Panji, ex-Dean, School of Earth and Environmental Sciences, Central University of Himachal Pradesh, for accepting our invitation at the very last moment and sparing his valuable time to deliver the valedictory address. Sir, we have really enriched with your words of wisdom. On behalf of organizers, I would like to extend my sincere gratitude to all our eminent expert speakers, Dr. K.H.V. Durga Rao ji, Dr. R. Shiv Kumar ji, Wing Commander K. Venugopal ji, Dr. Raju Thapa ji, Dr. Harjeet Kaur ji, and Ms. Vinita Kumari ji, for sparing their precious time and delivering very informative and insightful lecture. These eminent personalities have brought here with them their knowledge and experiences that will guide us in the right direction, and we appreciate that. We understand that you have taken out of your very important, taken out the time from your very important schedule to contribute to this training program. Thank you for your invaluable contribution towards this training program.
देर में बात कर रहा हूँ.
This vote of
ये चलने पर.
This vote of thanks will be incomplete with a special mention to Dr. A.L. Hardarji, convener of this training program, who deserve a big hand of applause for the amount of meticulous planning and overall supervision. I would also like to mention the constant cooperation and support of all the members of our organizing team, especially Ms. Dhaneshwari and Mr. Ajit, from their unstinted contribution. A simple thanks will not be enough for their tireless hard work, which has actually brought life to this event. I must say, we make a wonderful team. Last but not the least, if this training program has reached to success, is all because of you, the participants, from different spectrum of background, diverse fields, and from different corners of India. Thank you very much for showing interest in the training program, sparing your time and participating in it. Thank you. Thank you very much and have a great day.
And it is a big thanks to Dr. Ankit also. He has also given the equally support to make success for the last 10-15 days. He is with us. And also without the participants, we cannot be success, and a big applaud to them also. Now I want to, Dhaneshwari, would you like to tell anything? Dhaneshwari, could you hear us?
Yes, sir, I can hear you.
Anything you would like to add?
I would only like to thank all the participants, thanks to all the NIDM officials on screen as well as off screen who were involved in organizing this program, and especially to you, sir, for being such a wonderful host. And I also want to extend my thanks to Ankit, sir, to all the experts who gave such a wonderful lectures on the topic. So this was all about my side. Thank you, sir. Thank you all.
Overall, it is a big support from the this university, Central University of Himachal Pradesh, Dharamsala. Good activity they have done. Without them, without their support, this systematically program could not be taken place. Big thanks to all those off-scene, on-scenes, they are there from the university. It is there. Now, dear participants, that you will get the certificates, not now, at least computer will take, say, 3 to 4 hours after for the processing. So, and automatically it will process the certificate and it will goes to the appropriate persons, means that will be qualified, says 60% of the time for 3 days who will be present, and also who has enrolled. So keep in mind these two criteria, then and that they will get the certificates. And also I would like to inform you that in this next month, say 5th September, there will be a webinar on flood mapping. So I request that with the equal tempo, you please join. Now anything would like to Ankit further? If so, or else we'll go for the end of the event and we'll see in the next program.
Thank you very much.
Okay, sir. Thank you very much for a good support. Again, from my heart, I want to put you thanks a lot. And Professor Deepak Pant, in the last moment, he has given a good chance to us NIDM as well as these participants with his availability and with his appropriate remarks. So with this, we'll come to end for this today's session. Thanks a lot. Now we'll go for the end of the session.